Apurva Sachin Joshi from Vishwakarma Institute of Technology, Pune, and I am presenting a brief talk on cough and cold. So, basically, as I take the video into two parts, that is cold and cough. So, starting with cold, it is a easily spreadable infectious disease which has symptoms such as cough, painful throat, runny nose. Runny nose can be called in scientific in medical term as rhinorrhea, and fever. It lasts for 7 to 10 days, and sometimes in severe cases it may carry on for up to 3 weeks. There are 200 different viruses, but rhinorrhea is the most common cause. The recovery time depends on person to person because the immunity graph of each person is different. So recovery time varies from person to person. The prevention is you can wear masks, drink plenty of water, wash hands, etc. The average person gets 2 to 3 colds per year, or maximum 4 to 5 colds per year, while an average child of 6 to 12 years can get 6 to 12 colds per year, or 7 to 14 colds per year. Now we turn to the second part of the video, that is cough. So the definition of the cough is it is an action taken by the body to throw out the cough. That is basically it is a type of cough is a type of mucus. The muscles in the thoracic cavity contract to make air leave the lungs in a lot of force. So they happen quickly and more than once. So when we cough, it is not that we cough for only one time. It is for many times. But basically, for 6 to 7, it can be even worse. It also has a specific sound, more likely to happen when a person is sick. So this point is very important. When a person is sick, he tends to have a cough, cold, etc. It can also happen due to polluted air, the air which you are surrounded by, the atmosphere, etc. The prevention for this cough is stay hydrated, that is drink plenty of water, try hot drinks, that is try hot tea, try lemon water, etc. Lemon warm water, etc. Try a menthol cough drop. It is available in the market nowadays. It is also available in the medical stores. Fourth point is steamy showers. Take steamy showers. It will relieve your breathing system, etc. And also take a humidifier. That is, use a humidifier. And medications to treat cough and cold. These medications will be given to you by consulting your doctor, etc. So this was my brief talk on cough and cold. Thank you.
This is the PPT on cough and cold by Apurva Joshi, VIT Pune. Contents: respiratory tract infections, introduction, epidemiology, cough, common cold, and flu. Respiratory tract infections. Based on the parts of infection, respiratory tract infections are classified into two types: upper respiratory tract infections and lower respiratory tract infections. Upper respiratory tract infections, which includes common cold, cough, flu, tonsils, sinusitis, and fever, etc. Lower respiratory tract infections includes bronchitis, pneumonia, and influenza. Introduction. Cough, cold, and flu are common infections of upper respiratory tract that can be caused by over 200 different viruses. Cough, cold, and flu are the most common illnesses. Cold is a mild viral infection of the nose, throat, sinuses, and upper airways. It can cause a blocked nose followed by a runny nose, sneezing, a sore throat, and a cough. each year there are more than a billion cases of the cold, that is cough, cold, and flu in the United States, according to the National Institutes of Health. The effects of a cold can vary between individuals and the specific type of virus causing the infection. Epidemiology. There are no major gender or ethnicity differences in incidence. Most infections occur in the winter period. A 2000 US study found that 23.6% of adults had experienced a cold in 4 weeks. Children get 6 to 8 colds per year, while adults get 4 to 6 colds per year. Cough. Definition. Cough is the body's way of removing foreign material or mucus from the lungs and upper airway passage. A cough is a symptom, not a disease. Objectives. These are some of the objectives. You can read it by stopping the video. Mechanism. Classification of cough. This is the classification of cough, which is explained in detail. Let's look into it. Acute cough, which is less than 3 weeks duration. The symptoms are breathlessness, fever, chest pain, and weight loss. Subacute cough, which has a duration of 3 to 8 weeks, which is post-infectious. The symptoms are a cough that begins with an acute respiratory tract infection and is not complicated by pneumonia, which resolves without treatment. The cause is PND or tracheobronchitis or sinusitis or asthma. Chronic cough, which is greater than 8 weeks duration. The associated symptoms are fever, pneumonia, headache, UACS, that is upper airway cough syndrome, asthma. Cough is either productive or non-productive. Productive is which produces mucus, while non-productive is which is dry and does not produce mucus. What can we do? We can use our daily medications such as gargling, etc. Or if the case is much complicated, visit a doctor. Cough. What's it good for? Signal dysplasia, protect the airway from pathogens, particulates, food, other foreign bodies, etc. Clear the airways of accumulated secretions, that is, and particles. Cough. For a persistent cough, try menthol and certain herbal cough drops or hard candy to soothe the irritation. Treatment. Coughs can be treated in a variety of ways, depending on the cause of the cough. For mostly healthy adults, most treatments will involve self-care. Self-treatment. A cough that is caused by a virus cannot be treated with antibiotics. You can, however, soothe it in the following ways. Use decongestant sprays to unblock the nose and ease breathing. Elevate your head with extra pillows while sleeping. Use cough drops to soothe the throat. Avoid irritations, including smoke and dust. Gargle hot salt water regularly to remove mucus and soothe the throat. Keep hydrated by drinking plenty of water. Add honey or ginger to hot tea to relieve the cough and clear the airway. What do we give to treat a chesty cough? This is a medicine called robitussin, which has a dosage for adults and children especially. For adults, 10 8 hours, maximum of 3 doses in 24 hours. While for children over 12 age, 10 ml every 8 hours, maximum of 3 doses in 24 hours. For age group of 6 to 12 years, 5 ml every 8 hours, maximum of 3 doses in 24 hours. While for 6 and under, the medicine is not recommended. What do we give to treat a dry cough? There is also a medicine called robitussin, which is used for dry cough fault. The dosage is for adults as well as children. For adults, 10 ml every 6 to 8 hours. The maximum of 4 doses in 24 hours. While for children over 12 age group, 10 ml every 6 to 8 hours, maximum of 4 doses in 24 hours. For the age group of 6 to 12 years, 5 ml every 8 hours, maximum of 4 doses in 24 hours. And for the age group under 6 as well as 6, the medicine is not recommended. Antihistamine medications used to treat cough may include inhaled asthma drugs, termines and decongestants, antibiotics, acid blockers, cough suppressants, etc. How to treat a cough from cold or flu? You can't cure colds or the flu, but you can relieve the cough and sore throat that sometimes comes with them. Use cough drops or hard candy. Try a teaspoon of honey. Hydrate. Sipping on drips will keep your throat moist and comfortable. Use cough medicines. Heat up the drink. That is, drink soup, warm water, warm tea, etc. And heat up your airways. Breathe in steam. Avoid dirty water. Rest for sufficient time. Try nasal spray or rinse. Cold and flu. Definitions. A cold is the most common disease in the world. It is a contagious viral infection of the upper respiratory passages, including the nose, throat, and sinuses. A cold can also affect the ears and lungs. Flu is also a contagious viral infection. It affects the nose, throat, and lungs. Flu outbreaks occur in the late fall and winter with varying degrees of severity. The disease often spreads through communities, creating an epidemic. Both the cold and flu are caused by viruses. These viruses are highly infective and are passed on through direct contact with nasal secretion from infected people or objects, as well as airborne saliva droplets. Did you know that with each cough, about 1.5 L of air is expelled, and flying in that air is over 3,000 saliva droplets traveling at the speed of about 80 km per hour. Mode of transmission. It is very contagious, spread from person to person, usually from nasal secretions and from fingers to the affected person, Most contagious in the first 3 days after symptoms begin. Viruses can last up to for 5 hours on the skin and hard surfaces. Associated with a number of viruses, example, rhinoviruses, etc. Causes of cold and flu. Nasal deformities, a shift in the nasal cavity, nasal polyps, small growths in the lining of the nose, bacterial or viral infections, environmental factors, allergies, and pollutants. Cold symptoms appear 2 to 3 days after infection and last anywhere from 7 to 14 days. Some of the most common cold symptoms are nasal congestion, fever and fatigue, headache, common cold viruses or the flu, facial tenderness, pressure or pain in the sinuses, dental pain, sore throat and cough, runny nose, blocked nose, sneezing, coughing, high fever, hoarse voice, etc. How to keep away from cold and flu? Runny or stuffy nose. The best way to handle a runny nose is to remove the fluid. Blowing your nose is a quick fix, but a nasal irrigation product such as Neti Pot may also bring you some relief. Headaches. Antihistamines or decongestants may help relieve the pressure from inflamed nasal passages. Sore throat. A teaspoon of honey added to a warm beverage such as tea is a traditional home remedy that may relieve the throat. Fatigue. Your immune system is busy fighting off the infection, so you don't have much energy for anything else. Take it easy and relax. Extra sleep can do wonders. How to keep away from cold and flu? Exercise well and keep in good physical shape. Wash your hands regularly. Sleep well. Drink a lot of water. Eat well. Don't smoke. Treatment of cold and flu. Antihistamines, decongestants, pain relievers, cough suppressants, nasal strips, antibiotics are ineffective. When do I see the doctor? See your doctor if you have temperature over 101 degrees for more than 48 hours, a cough with pain in the chest, shortness of breath, persistent sore throat without a runny or stuffy nose. Consult doctor if your throat is very red and it hurts to swallow. No improvement within 7 days. Severe headache with a fever. Worsening pain in one or both ears. Any chronic medical condition, example, asthma or diabetes. What do we give someone with a cold or the flu? Adults, dry sore throat, give strepsils, honey and lemon lozenges or strepsils plus anesthetic throat spray. For runny nose, give Ranzine 10 mg tablets. For blocked nose, give Sudafed PE range. Headache and fever, Panadol, Neuromol, etc. For children, for dry sore throat, Strepsils Children 6 plus. Runny nose, Histaclear. Blocked nose, for over 12 years of age group, give Sudafed PE range. Headache and fever, give Panadol. Is there anything else we can give? Yes, vitamins and supplements, vitamin C, selenium, echinacea, herbal teas, etc. Beanies, scarves, gloves, etc. Wheat packs. Food to take in cough and cold, and foods to avoid in cough and cold. You can go through it. Natural remedy for cough, cold, and flu. Garlic juice, which reduces swelling and inflammation. Fight the free radicals, antioxidant and anti-aging. Cleans toxins out of the body. Ginger juice, effective antimicrobial, prevents our blood vessels blockage, strengthens the immune system, fight chest infections, coughs, and congestion. Natural remedy, cough, cold, and flu. Lemon juice, which promotes immunity, fight infection, strong antibacterial, antiviral, and fights infection. Honey clears mucus from nose and throat. Nutrition-rich natural sweetener. Digest heaviest meal and heals stomach ulcers. Apple cider vinegar with mother. Treats allergies. Counteract the build-up of lactic acid. Eliminate tiredness. Turmeric juice. Anti-inflammatory agent. Antibacterial and antiviral action. Relieving the chest congestion. Fight cancer cells. So, coughs, colds, the flu. Being cold, what's the deal? Coughs are protective. Stop further entry of viruses. Body's way of trying to remove infection. Runny noses are also protective. Extra layer to trap particles, but can cause post-nasal drip. More coughing, also caused by extra cold temperatures. Cold and dry air are also irritants. What is the prevention? Good hand washing. Cough and sneeze into arm or tissue, not into your hands. Aerosol sprays, example Lysol. Antibacterial sanitizers, example Purell. If any questions, leave a comment in the comment box or in the comment section. Thank you. This was a presentation made by Apurva Joshi from VIT Pune. Thank you.